And joining me now is the Minister of Health, Chris Hipkins. Good evening, Minister. Just in that piece we've heard there are a lot of buses still not displaying codes. I know it's not compulsory until 11:59 p.m. tomorrow, but is it disappointing that they're leaving it to the last minute?
Yeah, look, in some cases it may be a logistical problem, but, the bus companies, our message to them is, please get the QR codes up as quick as you can.
Logistical, printing off a piece of paper and sticking it on a window?
Well, sometimes it's the buses, will be away from the depot for a long period of time, but, look, we do want them displaying the codes as quickly as they can.
Okay, so you've had about 2 million downloads of the app and approximately on average 2 million scans, right? Where are the gaps here? Because that doesn't seem like many scans. Can we identify a geographic area or areas where the uptake isn't as good, age, or do we know any of that?
Well, bear in mind that, some people are more mobile than others, so some people will be scanning a lot more than that, and some people will be doing very few scans, and it depends on mobility. Some people don't actually leave their house every day, and so, that they won't be scanning as much. But, yeah, we would expect to see those numbers growing. They've been lower, of course, over the last couple of weeks because Aucklanders will have been largely staying at home, as we've asked them to do, and that's a significant proportion of the users of the app. As they become more mobile again, we'd expect to see those numbers starting to climb.
But can you see any other gaps in the data?
Not really. Obviously, the people hold their own data, and we access it if we need to with their consent. They can hand over their data. But the key message here, same as it's been all along, is every New Zealander should ask themselves the question: if I got a positive COVID-19 test and I had to identify everyone I'd come into contact with in the last 2 weeks, what data would I use in order to what information would I draw on in order to be able to do that?
Is this why we need to crack on and get a COVID card as well?
The COVID card's not necessarily a silver bullet either.
No, but it's another tool, isn't it? And it would plug some gaps. So do you need to move faster than we currently are with this project?
Not necessarily. There are some issues with the COVID card as well. As with any of ththese technologies, avoiding complacency is one of the big challenges here. So making sure that people use them and use them consistently is actually what the big challenge with any form of technology.
Okay, there are lots of threads to this current outbreak, so let's try and tidy a few of them away here. This morning at the Health Select Committee, you said the maintenance man from Ridges had infected 2 people. Who?
Yeah, no, sorry, I got that one wrong. There were only 2 people in that group, and of course the other person is the traveller who infected that person. So
are you going to correct the record then at the Select Committee?
Yes, I can send them a note about that. Of course, the Select Committee gets dissolved on Sunday as well.
So that's a closed case now. So have you accepted that this is definitely a surface transmission?
That would have, look, there's no 100%, finding there, but yes, they have closed the case. There's no further information that they're likely to find there, and therefore, we'll never know 100%, but the most likely scenario is the transfer via the lift.
Have you given up on finding out what the origins of the Auckland cluster are?
No, we haven't given up. We have to accept that we may not find them, but we're still continuing to investigate. Because the more we can find out about that, the more we can learn from it. So
what are the active open lines of investigation for sourcing the original infection?
Every new case provides new information and new contacts, and at some point, hopefully, the pieces of the puzzle will slot into place. But at the moment, it is still just that. It's a puzzle, and there's still some missing pieces in the puzzle. But from what you're saying there, Minister, you're waiting for additional cases, so there's actually nothing still under investigation actively in terms of sourcing this. You've exhausted every option so far. They're still doing further testing and further, genome sequencing where possible. The science is giving us some clues, but we're not able to get genome sequences for all of the past cases, and that obviously would be very helpful, and it would certainly help us to identify where this is likely to have come from. But at the moment, we know what we know and we know what we don't know, and there's still missing pieces in the puzzle. So we've had just over 1,400 cases. How many do you have genomic sequencing for? I think it's somewhere around half. of those who went through managed isolation or quarantine facilities. The earlier community transmissions that we had pre our lockdown period, I don't have the numbers of those that were genome sequenced.
Okay, so how many cases are currently still under investigation because health authorities haven't yet established a genomic link or an epidemiological contact with the cluster? How many?
As far as I know, all of the cases, there's one or the other. So there's either an epidemiological link or a genomic link. In some cases, the genomic link is the one that's identified first, so we know that it's linked through science, but we don't necessarily know exactly how people came into contact with one another. And that's one of the things that keeps getting investigated. We're talking about a small number of cases.
Sorry to interrupt, Minister, but in terms of those physical links, right, so who they came into contact with and got it from, how many of those cases are there where you can't establish that contact where the spread happened?
It's a small number. It's a handful. It'll be 2 or 3, maybe 4, but they tend to be the more recent cases, and so those links normally do get identified through the contact tracing process. It's a big part of what that process is designed to achieve.
Okay, there was a case recently, a St Luke's retail worker on a bus. How many people, just for clarity, were infected on the bus?
There's only one other positive case that's come off the bus so far, but obviously I think around, from memory, I haven't got the number right in front of me, it's been around 18 people off that bus have been tested.
Okay, so what more can you tell us about that case? Did health officials view the CCTV footage of that journey? Because we're interested to know how close those people were sat next to each other.
Yeah, like I said, they've tested about 18 people. My understanding of the bus trip was that the bus was stuck in traffic, so it was a several-hour-long bus journey, and those people therefore were sitting in close proximity.
How close do you know, Minister?
Well, we don't know. I don't know the exact seats, but I know that both of the people, both the person who took COVID onto the bus and the other person who's tested positive, were both sitting near to the back of the bus, so they were sitting quite close together.
But you can't tell us exactly how far apart were they. So has the CCTV footage been viewed? Because there was CCTV footage on that bus.
Yeah, the contact tracing team may well have viewed the CCTV footage. I haven't myself, obviously, and I don't have that information in front of me.
Because it's quite vital, isn't it? Because that may change the way we think and the rules and protocols we follow if they were further apart than you might imagine they would be for infection to pass.
Yeah, I mean, we're already looking at what we can learn from this most recent, cluster of investigations, and one of them is that public transport is a risk area, which is why you're seeing that we're putting QR codes on all of the buses and trains, and why we're asking people to wear masks on public transport. Because again, we're doing everything we can to try and reduce that risk, even before we've got definitive answers to some of those questions.
So you're going to update airline crew protocols by the end of the week. Are you toughening them up?
Yes, there will be, and there'll be some new requirements in there as well. Look,
are you making them significantly tougher?
I wouldn't call it significantly tougher. I think what we're doing is strengthening some of the existing protections that are in place, just to give people that degree more confidence.
What bits need to be strengthened?
Well, look, I'm not going to announce that today.
No, generally, which bits need to be strengthened?
I think people want to know that, the arrangements for international crew who are staying in New Zealand are robust, and that avoids them coming into contact with the public. And so we've been doing quite a bit of work just to make sure that those are as robust as possible. And that for the New Zealand crews who are doing layovers offshore, that there's a good isolation and testing regime for them when they return.
So can international crews visiting New Zealand expect more requirements around their stay?
Yes, I think that'd be a fair conclusion, and we'll have more details on that shortly.
Okay, so what specifically are you gathering together in terms of information and advice before the decision is made on Friday regarding levels?
Look, we look at a lot of things. We look at number of new positive cases, whether the growth in the case numbers is accelerating or slowing. It's not necessarily just the number, though. It's also the nature of those cases. So are they existing contacts? Are they following a predictable model, or are they throwing up some unexpected results? Those are the sorts of things we'd look at. What's the adherence to the restrictions that we've got in place now? Are we confident that we're not increasing risk or not increasing risk unduly if we change any of the alert level settings? Those are all the sorts of things that we consider.
So do you reckon we're looking good for a drop down in levels on Friday?
Look, I wouldn't get into that prematurely. I think there's still a wee way to go. We've still got a good another 48 hours worth of information together before we make those calls.
Appreciate your time this evening. That is the Minister of Health, Chris Hipkins.